My name is Alyssa Elliott. I am a registered nurse and will soon be completing the baccalaureate nursing degree program at Lamar University. I received my associate's degree in nursing in May of 2015. As a graduate nurse, I began working in a neonatal intensive care unit, and that is the specialty I have been in for nearly 4 years. Within the past year, I have joined the cardiac team at Children's Memorial Hermann in Houston, Texas, where we focus our care on infants with cardiac defects, prepare them for their surgeries, and care for them after their post-op recovery in the pediatric ICU. I have been a preceptor to many student nurses and hope to share my love of NICU. The learning outcomes for the baccalaureate degree program are broken down into 5 categories, and they summarize what is expected of the graduate nurse at the completion of the program. The first is humane in society. Practice safe and effective holistic patient-centered care to a variety of patients or clients in multiple settings from a global perspective by incorporating theories and evidence-based findings. I believe this outcome was met in our comprehensive holistic health assessment course as we refined our patient care skills in the shadow health assessments, as well as when we compared our current practice to the goals in Healthy People 2020. Lifespan Health Continuum. Support patients in preventing disease, maintaining wellness, promoting and restoring health, and advocating for death with dignity. Evaluate patient-centered care for patients across the lifespan based on common and complex health needs and compromised multiple health states when considering multiple determinants of health. In the course Nursing Practice Care of Patients with Compromised Multiple Health States, we did several practicum reflections, and mine involved a woman healing from having her ovary removed after finding out she had ovarian cancer, and speaking with her about the physical and mental aspects of that surgery, diagnosis, and recovery. We also met this outcome during our discussion board postings in regards to end-of-life care and how to best honor our patients in this vulnerable time. Evidence-based practice and clinical reasoning. Synthesize clinical reasoning and judgment in nursing practice utilizing critical thinking, nursing process, research, and evidence-based practice. I truly feel like every assignment was rooted in evidence-based practice, but in the course of nursing inquiry and evidence-based practice, we spent several projects dissecting quantitative research, and then one of our final projects was on qualitative research. Patient or client-centered care. Employ safe, effective, patient-centered care using theories and evidence-based findings in collaboration with patients and members of the interprofessional and intraprofessional healthcare team. During comprehensive holistic health assessment, once again we were able to have a hands-on approach with the shadow health assessments. And in our course on leadership and management in the healthcare system, we wrote a paper on effective leadership and qualities, where I discussed in depth what it takes to be a leader and how best to work together with other members of the team. I discussed that a leader not only knows how to instruct, take charge, and delegate, but also how to follow, listen, and receive constructive criticism. Professional roles. Differentiate multiple role dimensions and practices within ethical, legal, and regulatory parameters when caring for patients as a member of the interprofessional and intraprofessional healthcare team. Demonstrate professional integrity, effective communication, active inquiry, and service to the community. I learned so much during the Care of Communities course. I never really understood the community I grew up in, but all of these assignments allowed me to really dive into this particular area and learn more about what it takes to care for the people here. It was also very interesting to learn all of the roles that come together to prepare for and manage a disaster. There are certain things I know are in my 5-year plan and others that may or may not be a part of it because life is always changing. I know the next thing that I will do will be test for my RNC NIC, which would mean I would be a neonatal intensive care certified nurse. I have worked in this specialty for almost 4 years, so I meet the requirement of 24 months of specialty experience. The certification is good for 3 years. You have to take an NCC continuing competency assessment, and that is what determines how many extra hours of CEUs you will need outside of the requirements of your RN renewal. I want to be PALS certified so I feel more confident caring for our older chronic babies. I have precepted nursing students, but I would like to start precepting new grads or experienced nurse transfers. One of the classes I had to take before being a part of the cardiac team was cardiac stable, and I really enjoyed it. I would like to become an instructor so I can be a part of training new team members. The last thing on my list is my master's degree. Sometimes I lean more towards becoming an educator, but other times I think it would be great to be a neonatal nurse practitioner. In the next 5 years, I will start some type of program to further my education, but which program it will be is yet to be decided. I'd like to thank all of the instructors in the Lamar University RN to BSN program for everything they've taught me. I enjoyed being a part of this program and have recommended it to many fellow nurses. Thank you.